Good afternoon, everyone. Thank you for joining us. Maybe on your lunch break, maybe not quite lunchtime yet. We're excited to have you here with us. I am going to give it a few minutes to let everybody come in from the waiting room, and we will get started in just a minute or two. And as you come in, if you guys want to put who you are and where you're from in the chat, we love to see where everybody comes from. We are in webinar format today, so you won't see yourself in a box. You can't come off mute, but you can communicate via the chat. And if you have any questions for our presenters today, Ivy or Simone, you can also feel free to use the Q&A. This is being recorded. If you've joined us for any of our other series, we'll send out a wealth of information following this webinar with the recording link, some resources that Ivy and Simone will talk about today, a copy of the slides, and I will let Ivy and Simone talk about Q&A and kind of how they'll handle that. But we'll give it about one more minute. Our numbers are starting to trickle down. And then I will turn it over to Ivy and Simone. So if you're just joining us, throw your name, where you're from in the chat. Looks like we're quite spread out across Illinois today. Lots of our birth to five friends I see, some AOKs. This is great. Well, welcome everybody. Yeah, we are just all across Illinois. So this is great.
Love
Okay, it looks
that.
like our numbers are kind of calming down a little bit. So I am going to turn it over to Ivy and Simone. So feel free, ladies, take it away.
Thanks so much,
Hi,
Kristen.
everyone. Hi, everyone. Welcome to our training. Like Kristen said, please put your name in the chat, your organization, or what role or hat you're wearing. In addition to, let's just put some brightness into the day. What is something that makes you smile? If you're having a sad day or having like a bad moment, what's something that you think about that makes you smile? To me, any picture of my cat makes me smile. He is such a lovely, cuddly boy. So
Aw.
that's for me. Um, Simone?
Yep, my child, I can't believe she's 4 now. Every time I used to do presentations like this, she was in the infant toddler spectrum, so now she's big. It's hard to believe. Kids and grandkids, cats, puppies, always, right? Those are the things that make it all worth it. So I am so happy to be with you today, and thank you, Kristen, for this opportunity. I'm the director of Raising Illinois, and I'm here with our operations lead, Ivy. Um, and Excited to talk to you a bit today. I'm so excited. We have providers from all over the state, which is great. I know last time our session was a lot around how to center advocacy at the heart of what we do. So, Ivy, this one will be a little bit more around what is the landscape that y'all operate in, and why are providers such a critical piece of advocacy?
Yeah. So we can go ahead and jump into the agenda. We'll be discussing why advocate for early childhood. Obviously, we're speaking to the choir here, but moving on to the power of provider voice, understanding the early childhood policy landscape, which can be very messy a little bit, and moving forward to pathways to action, ways to get involved, and then we'll be concluding. Like Kristen said, we hope to have time for Q&A at the end. However, if we don't get to it, or if there's any pressing questions that you want to have, feel free to put it in the Q&A function, and then we'll circle back either individually or if there's like certain repetitive questions, like certain themes, we can share that out in the follow-up email that Kristen will send out. So feel free to use that function as well. So why advocate for early childhood? So just really quick, what do you think are the benefits of early childhood education? If people could just really quick, maybe drop something in the chat of like what you think the benefits are. Feel free to maybe cheat a little bit on the bullet points that are there.
So just to share my own journey here, I started in K-12, and mostly in the high school space. And I thought, if I really get a little younger, maybe into the elementary, then I'll really be able. And I just went younger and younger all the way to prenatal to 3, and it doesn't get any earlier than that. So it was out of a desire to really have more impact during that period of neuroplasticity, those first couple of years where. I know we've all seen it in our own kids or, at work, just that crazy period of development, those first few years. And it's crazy to think about. That's exactly when our system shortchanges children the most, right? And families, expecting families the most. So,
Yeah,
so lucky to be able to work in this field. Mhm. That's right,
yeah.
Christine.
So some of the benefits definitely are like fostering healthy development during those critical years of life. We know that like birth to 5, the brain is developing very rapidly. So trying to make sure we capitalize on the healthy development is really important. It also eases transition and prepares children for school, improves health outcomes. And if you think about it from an economic standpoint, it generates a 13% annual return on investment. Um, if we want to think about the numbers that way.
I love
Um,
when we're talking to early care and learning folks, you could just see the chat light up, right? Getting them establishing routines, getting them used to different routines. Love the comment on diverse learners and where folks are on the spectrum, all of that. Child's advocate, social development. You're all on the same
yeah,
page. Yeah.
right on the money. So specifically, why advocate for early childhood? Well, early childhood communities and families need, our support. Quality early childhood education and care benefits young children, which in turn benefits families and therefore communities and ultimately our country. And unlike the K through 12 system, there's no unified system for early childhood, which makes it more difficult for families to find the support that they need and overall navigate the system. It's since it's not uniform, it's a little tricky to say like, is there an open spot here? Is there a wait list here? And so because there's no like streamlined structure, it can be very difficult to navigate and therefore advocate on behalf of your child and um, your family.
I don't know if
Um,
you guys experience this just looking at the chat. I mean, I know when I tell people who don't work in early care and learning that I'm like, it's not like, there's one system that rules them all. Like, I don't get, one check per pupil the way that it works in high school. Like, it's completely different. And there's so many people are like, really? And you're like, yeah, it's interesting.
yeah. Um, so yeah, so a little bit on the power of provider voice. A little bit of the meat and potatoes of what we're here to do. Um, so as you all know, you all are not just implementers of programs, you are also experts in the field and you're actively shaping policy. Um, and so, why does your provider voice matter? Well, because of credibility. I mean, you are there doing the firsthand experiences, working in the workforce, seeing firsthand how policies and programs are impacting not just your life, the workforce around you, but also the families and the children themselves. Seeing um, how maybe a stipend in a funding gap can prevent you from paying your employees or receiving in a salary adjustment or pursuing a different credential. So really having that on the ground experience is what's really important and distinguishes the power of provider voice versus the power of family voice. And obviously, yeah, there's some providers who are also families. So like feel free to wear like your dual hat when it comes to like I'm a parent, but I'm also a provider. So I also get to kind of navigate this provider space. Um, and ultimately, providers have the trust of the family and the caregivers. Because you work hands on with children and the families, you've developed that trust. And so you're able to kind of understand their needs and also, from your perspective, understand what you need as a provider as well. And policymakers, legislators, decision makers, influencers, they all rely on real stories from providers that they've seen in the workplace, you know. And so data plus stories equal influence. So you all on the call have a lot of power and a lot of influence as providers. And so I hope that you know how amazing you truly are, and also like the the advocacy potential that you all have.
Absolutely. So, I know, and I hesitate to even use the word unprecedented because I think we're all, if you're like me, you're tired of hearing it, but we're definitely living through some times. And some times that, even folks who have been working in this field for decades, there's some changes in this landscape that affect providers meaningfully. And so want to talk about them today and then talk about opportunities to connect. You guys, this is the picture that captured how I personally have been feeling. So um, definitely let me know in the chat if you feel the same. There's been quite a bit happening in our field. Sorry, folks, I'm looking at the chat and I see. Oh, okay, good. Are you guys able to see the video? Yes? Okay, put in the chat a big no if you can, so we know to help you guys. All right, sounds good. Oh, you cannot see the slides. Okay. Okay, let's maybe reshare. Thank you.
Oh,
I can see. Oh, interesting. Okay, so it's working for some people and not others. That's
okay, let me
fascinating.
stop sharing and then reshare. Maybe that would work. There's no video. It was just
No,
the
no, no video, just slides.
sorry for the technical difficulties, folks.
Great. Okay. We'll try this again, and then the great thing is we can also send out our slides so that you guys can have everything in front of you. So it's a picture of somebody caught in a giant windstorm, holding on by one hand. That is how this has felt to me personally. We have federal policy changes, threats to Head Start, funding streams that many Illinoisans that work in early care and learning rely on every day. We had the federal Health and Human Services funding freeze of Illinois funds. And then we had our own state transformation with the creation of the Illinois Department of Early Childhood and an early intervention crisis. And I know from folks dropping comments in the slides that many folks on this call are like me, and their heart is often with children with developmental delays and disabilities that are too often left behind. So, what has this all led to? Fatigue, saturation, incredible pressure on providers, on families, on, frankly, everyone who touches this work. Okay, next. So, wanted to kind of condense what we've seen recently on federal funding instability, and happy to take more questions on this. A lot of what we've done is unpack what's happening at the federal level for our Illinois folks and then represent Illinois' voice to some of our national advocates who are either, we are in a multi-state lawsuit around this, obviously, and are doing a lot of advocacy efforts with national partners. So on January 6th, the federal government froze federal child care and social service funds to 5 Democratic-led states, including Illinois, citing concerns about fraud and misuse, even though there was no evidence presented of that fraud or misuse. And that was more than $1 billion of Illinois funds. So you could see the three main funding streams that were frozen that really affect folks on the ground. And we've had so many of our family leaders, of our provider members say, like, this is, not sustainable. And then on February 6th, a month later, the court put a preliminary injunction that freed up those funds. But of course, that instability is still bad, both for people who are doing this work, with young children every day, for those families that rely on those funds to function, for those childcare centers or home-based childcare programs that rely on funds as well. So, and this doesn't even include those things like, I don't know if you guys we're tracking, like, and it's impossible to sort of like take in all of the news and implications of everything that's happened, but the freezing of the substance use funds that was then unfrozen just a couple days later, right? So some of this, even if the funds are put back, that instability and that damage is done to the people who get a letter or an email saying, hey, this isn't happening for you anymore. Oh, just kidding. Yes, it is. Like that also has such a destabilizing effect on our work. Next slide. So again, that's the federal context. And when within that, we have a really massive transformation of our state work as well with the creation of the Illinois Department of Early Childhood. So what we've done, and we've been really fortunate to have, to have our partners with us in this work as well, is really try to demystify what these recommendations coming out of IDEC would mean for families and providers, and then also bring our families and our providers to IDEC so that they're sharing really real-time feedback about what these changes would mean and what questions that they have. For the last couple months, we've been convening a group of infant toddler providers with our colleagues at Illinois Action for Children that facilitate our care and learning group. And I see a couple names of folks I recognize from that group. We had IDEC come present their recommendations. We gathered our folks together between 90 and 120 folks, created a memo for IDEC about our key considerations and concerns that we had, and I'll share that as well. And then was able to give that to Maya and other folks to really make sure that they heard, the voice of infant toddler providers. And then with our colleagues at We the Village, for folks that are not working necessarily in IT settings, but are in that early care and learning in the older grades, work with them as well to make sure that we're again presenting clear, reliable information about what's going on, since this is such a crazy making time and landscape to be operating in, and then also capturing questions that folks have and making sure that those get to our IDEC colleagues as they do this work. So a couple of things. Tell me if this is, put it in the chat if you're like, yes, this is useful, or no, we already know this information, and I'll just make a quick decision based on what we see. Useful to go through the IDEC recommendations. I see a yes. Yes. Okay, great. Awesome. Thank you. Okay. So I'll go through this relatively quickly and then I can always come back and give more detail. Ooh, good. A lot of yeses. Love to see that. Okay. So again, we try to do this again, not just for y'all who work in the system, but also for our families where we're like, when they hear terms like funding design, alignment, funding adequacy, distribution, like what are the actual differences between what is the what that we're talking about when we talk about funding design? And I'll share these slides at the end as Kristen and I mentioned. So funding design in the field of early childhood has always been complicated. And for those of us who have worked in K-12 and other settings, you could get one per pupil pay and you could count on that. And that was coming from one funding stream and that was what you got. And here, we've always had to sort of braid and blend funding from different funding streams with different rules and different processes. And it's always kind of been, chaotic and extremely complicated. And it's also been administered by different public agencies. So part of the promise of IDEC is to make this simpler and more streamlined by having one big agency. However, there are early childhood things that are not coming under the new agency, and we'll talk about that in a moment as well, right? But funding design is really like, how does those funds get to the people who actually use them to serve children? And funding alignment is looking at how can we streamline this process and cluster funding streams together to make it so that you're not having to worry about different streams with different rules, right? Funding distribution is how the money gets from the states to actual providers and families. That could mean a competitive grant, that could mean a non-competitive grant, like a workforce grant, or it could mean a voucher. like for CCAP. And then funding adequacy, you may have also heard called the true cost of care, is how much money, again, for our providers, I know this is something we talk about all the time, how much money it actually costs to do the work in the way we know it needs to be done, right? So that's just a little bit of the terms that you will see over and over again in the IDEX work. Next slide, please. And this shows you a little bit about what shaded in blue is going into IDEC. And again, we can send out these slides and we have a lot of discussion about this if it's useful to you. But also shows you what's not necessarily what's not coming under the new agency. So it's not everything that we talk about when we think about everything that serves infants and toddlers and expecting families, but it is a great deal of what that will mean. Next slide. So, thinking about the funding alignment recommendations. Now, again, this is not going into effect now. This is IDEC sharing with the public. Here's where we anticipate going. That they're going to create two clusters of funding, and you can see what would go into each one here on the early learning and care and on home visiting. Next slide. And then on distribution and adequacy as well. Next slide. So I just want to talk a little bit about so let me drop a couple things into the chat. I can do two things at one time. You can do this one. Okay. So the first thing I'm dropping into the chat here is our overall great question, Rochelle. One second. The first thing I'm dropping in chat is our overall agenda. So you can see what we consider critical for infant toddlers and expecting families, everything they need to thrive. And one thing you'll notice about our agenda is it covers not just the traditional education streams, right? Because again, we need healthcare, we need maternal, we need perinatal care, we need, right? All of those things, birthing, that all of that matters, right? And the same thing around economic security, WIC, SNAP, TANF, all of these things that are under threat now federally are critical, we know, because families with young children need these supports in order to survive and thrive, right? So yes, absolutely, we will share the recording and slides. So the agenda, the first thing I dropped in the text shows you what we as Raising Illinois are looking at across the different buckets. The aim of the IDEC redesign is to simplify the process and have fewer constraints on providers. However, the way that they will do that will means if they will be successful or not, right? So there's some concerns. Hey, if you bucket these funding streams, make sure that you don't do that in a way that ties the provider's hands, right? So one more thing I'm going to drop in the chat right now is it's between 15 and 20 minutes of a video that we did
Oh,
together with We the Village, that shows you, in depth what these recommendations look like. And we have a discussion with Kim Bianchini, who's both on the Transition Advisory Committee for the new agency, but also is a longtime provider and really shares some of her concerns. So great to watch. And then also we'll put right now, I'll put my email in the chat in case any of you have to leave and have lingering questions. Okay, so to sum up, we have a chaotic federal landscape which does affect Illinois dollars. We have an Illinois transformation. And then just to speak to a minute, and I'll drop the link in the chat as well, last on the 18th, Governor Pritzker proposed his fiscal year 27 budget. And he did, and you could tell in the budget that he sought to protect early care and learning streams, right? So there were cuts, and we received fewer cuts than other areas of the budget. And there was an increase to early intervention and to childcare, and the potential for an increase on evidence-based home visiting. So you can see all our reaction and breakdown of those changes in the fiscal 27 proposed budget. But wanted to take a moment to talk first about how Raising Illinois seeks to influence this process and how you, as providers, are a core and critical part of that.
Yes. So pathways to action. Just really quick, talking about like what do we mean when we talk about advocacy? So advocacy is supporting, defending, or arguing for a cause, an idea in public to influence opinion, policy, and resource allocation. There can be like self-advocacy, there can be systemic advocacy, legislative advocacy. So there's different forms of advocacy as well. What are the roles of advocates? Um, Advocates work to bring about change by raising awareness, organizing campaigns, and engaging with policymakers and public. Um, I would say that everyone on the call is an advocate. I think everyone on the call has at one point or another advocated for a family, for a child, for the program, for themselves. And so just really honoring that you're also an advocate in addition to whatever like role or professional job title you have. Um, so, what do we actually mean when we say early childhood advocacy? Well, it's advocacy in early childhood education and care space um, that involves actively supporting and promoting the rights and needs of young children and their families. So, this I would say is a form of early childhood advocacy. Um, so, specifically within the context of Raising Illinois, our prenatal to three statewide coalition, the types of advocacy strategies that we participate is in legislation, budget, administration and implementation, and public engagement and uptake. So right now we're kind of doing the public engagement and uptake piece. Um, and just want to be mindful that the legislative advocacy and the budget advocacy really goes hand in hand. Um, as some people, may know, right now is legislative session. Legislative session occurs from January to May. And so, as Simone mentioned, Governor Pritzker has announced his statewide budget proposal. And so now we're in the process of saying, like, oh, are these dollars actually allocated in the way that we want them to? Is there any advocacy or any leeway that we can have to kind of counteract that and try to get more bang for our buck in a sense. Um, so just really quickly, this is the Illinois legislative cycle. I know it's like very heavy, but just to say that it starts in January and goes really through May 31st, and then the new fiscal year begins, and then we move on to veto session. So I just really want to highlight that right now we're in the budget advocacy process. Like Simone has mentioned, we already saw the state of the state in the budget address, and uh, submitting bill proposals has already passed. So now we're in the process of like advocating for the legislation and for the budget process. And if anyone's any questions over this, feel free to like drop them in the chat, and we can also follow up exactly on like when um, uh, for different strategies to advocate on depending on where we are in the process. This is I just wanted to highlight that this is the governor's proposed FY27 budget for the Illinois Department of Early Childhood. It's very tax heavy, but again, like we said, there's a $15 million increase in early intervention, a 55 million in CCAP, and we're still kind of figuring this out. So this is not set in stone. This is the proposed budget. So what I want you all to take away is that there's still time to influence and provide your opinion on whether or not you think that these dollars are adequately allocated to programs.
That's right, Ivy. And so, just to give a little bit of an example of what Ivy's mentioning, right? So, early intervention is a program that we've talked about for years being in crisis. So, the Raising Illinois Coalition has had the Babies Can't Wait campaign, where we talk about how critical early intervention is, why it's needed, and why we don't have the resources to fulfill our obligation, right? Families are legally entitled to receive early intervention services if they have a child with a disability or a developmental delay. There are people that are waiting on lists for services and shouldn't be, right? the $15 million increase into the early intervention program during such a tough budget year definitely signals that our advocacy and our partners' advocacies matter, right? That this administration and that the team at IDEC know that this is important and hear us. But we also know that that's not enough to eliminate the wait lists that parents and children are waiting on today. So that's one where we're going to continue our budget advocacy, even as we are thankful and grateful that both the governor and IDEC and the ILGA have all talked about how important early intervention is.
Yeah, definitely. The $15 million increase is definitely cause for celebration. However, like we've known that like research and cost model shows that 45 million is closer to where we need to be. So again, we're just missing a little bit of the gap. So while we want to honor and celebrate, like, yes, we have, you know, the governor's attention and like we're putting a good amount of pressure on it, we also want to be mindful that like there's still room for improvement and really want to hone in of like we really can't do a disservice to these children and these families because it is an entitlement program, like Simone mentioned. Um, Moving on. So now that we talked a little bit about what advocacy looks like, what advocacy is, the budget proposal, let's talk a little bit about who are the advocacy targets. So depending on the type of advocacy you're doing, you know, it kind of depends. It influences who your target is. When we talk about legislative advocacy, budget advocacy, advocacy for early childhood education and care, a lot of the targets and decision makers tend to be our Governor J.B. Pritzker, our state legislators in the House and Senate, and ultimately the Illinois Department of Early Childhood. These are people who are appointed to lead and provide policymaking and structure. But there are also people called like influencers. These are like individuals or group who have access to these decision makers, who have access to policymakers, and can also influence them. And so it's important to keep in mind when it comes to advocacy of potentially seeing if you can also connect with an influencer to see if they can align because they're also at the ear of J.B. Pritzker, legislators, IDEC. And some examples of what influencers are associations, organizations, families, providers, experts, faith-based groups, you name it. These are like folks who have the trust of decision makers and are also able to influence in their own way. So now that we talked a little bit about advocacy strategies, advocacy targets, so why are these advocacy targets important to you? Well, they're important to you because they are accountable to you. Remember that the policymakers, the legislators, you're their constituents. So they're accountable to you. They write laws, they vote on proposals, and they also take part in creating the budget like we talked about. So they inform allocations to funds and then therefore how that impacts families and children. So that's why they're important to you. And for a while, I used to be a little intimidated when it came to talking to legislators, when it came to talking to policymakers, because I was like, they're in a position of power. They're so cool. They're so smart. But I really had to like hone in of like, oh, I'm also their constituent. I also have a power as an individual, as a part of Raising Illinois, as a part of Start Early. I also have like a sphere of influence by also being my own person. And so just really wanting to like hone in of like, yes, it might be a little intimidating, like talking about like legislative advocacy, budget advocacy, talking to IDEC. There's these fancy peoples with like a bunch of like acronyms and fancy titles behind their name, but at the end of the day, like you are also a person with a perspective and an opinion, and it's really important to also, you know, share your voice and advocate for what you think is best based on your experiences, based on the families and the children that you serve. So I just really want to kind of like bolster that self-confidence that like these folks are accountable to you, and therefore you should feel empowered to be able to like advocate on their behalf. Um, so wanting to transition a little into like ways that you as providers, as folks in the field, can get involved. Well, do you want to take this on, Simone, actually?
Sure, yeah. So there are and again, as I'm sure has been clear from our presentation so far, there's a lot happening right now. A lot of things that many of us didn't anticipate seeing in our career, and a lot of again things that we've been fighting for years that are at various stages of coming to fruition. So if you're an infant toddler provider, please do join the Raising Illinois Care and Learning Group. And that you can always use that info at raisingillinois.org, and we will connect you with the right folks, depending on your area of interest. If you are interested in advocating for folks, for children and families with developmental delays or disabilities, join our early intervention group. We also are really excited to have a partnership with Equip for Equality. So if you know of a parent who is currently waiting for services, we would love to help that family. So please reach out. And we're fortunate to have partners that can give really robust support to families that are looking to navigate the system and get the services that their child needs. Home visiting, same thing. You'll see in our budget statement, we have not yet received confirmation on the budget line for evidence-based home visiting. We're watching very closely. So would love for you to join that group as well. And then we stand up each year activity groups based on what is the opportunities and needs of the moment. So these groups there's so much that we have yet to do. All of these I anticipate will continue into the next year and years beyond. But we also are creating new groups, right? So around maternal health, perinatal health, we know we're having an area of interest over there. Economic security, SNAP, TANF resources for families that are getting, hit with, increasing childcare bills, increasing bills at the grocery store, right? No increase in cost of living, resources to fight the increased cost of living. So the other thing is if you are a provider for the older years, we partner, I mentioned very closely with Illinois Action for Children and We the Village, and they run a monthly group that we both participate in around funding. So if that piece on the IDEC funding recommendations was important to you, I dropped the link in the chat to a quick video that gives an overview, but then also join us once a month. We unpack the latest, both on the federal funding recommendations and on our state funding recommendations as well. So I'm excited that we have some time for questions. Kristen, is that okay if we open it up and answer some questions? Ivy, anything else
Yes,
that you would like to say that
absolutely.
I forgot?
Yep.
All right.
Should I stop sharing? Would that be
Yeah, I
easier?
think that's fine.
I did believe I saw one question in the Q&A chat. Can you join more than one work group?
Absolutely. Yeah, that's a great question. And we have a lot of people that do, because again, you know this, right? If you're a provider, you're going to have families that may need more of one thing or may need more than another, right? Or you may be wearing different hats. We have folks that are on fire about early intervention because they have a child or a grandchild, right? Or they see a family at work and they want to help that family. But then they also are like, well, wait, how are these funding recommendations going to affect my place of business, right? And like, let me make sure I know what all is happening. So you can definitely join more than one work group for sure. And again, we do coordinate across with our partners so that you can come into a semblance of a coordinated approach.
There's a question about what we're doing about early intervention. And so I can really quickly um, um, show you all our Babies Can't Wait, We Need early intervention campaign that we're doing. Um, so like we mentioned before, the budget address did occur. And so we had a quorum that advocated for folks to ask Governor Pritzker to increase funding for early intervention. And so we are now in the process of creating a quorum to target legislators and lawmakers. So we're in the process of doing that. And once we have, those links set up, we'll definitely loop back with Kirsten and you all to see if like maybe that's something that you're interested in. To feel free to fill out. But in the meantime, we are having a like story collecting quorum where we're asking folks to share their story about early intervention, whether it's a successful or maybe not so successful story, whether you were able to receive services right away and these services really improved, the development of your child and you're seeing the, long-term impact and things are growing great, or whether, it took time to even get the assessment, or it took, you were on the wait list, or you're maybe like in a geographical area where like there's not that many specialists, so you had to like wait. Whether it's a good, bad, or kind of in the middle early intervention story, we would definitely love if you would feel free to submit your story and also share this link with folks. Feel free to follow the web link or the QR code. Like we talked about, storytelling, it can be a form of advocacy, right? Because we are kind of using, not use, maybe not using, but we are framing the needs and being able to talk to legislators about. So, for example, if we're talking about early intervention, by being able to talk specifically about not just the numbers of like X amount of people are in a wait list, but specifically, this is how this individually impacted my family. It's just much more personal and humanistic to be able to see that versus like just sharing data and graphics and figures.
Yeah. I
That
think
makes
that's
sense.
right. And we have some of the data and graphics and figures in our fact sheet and other places. And that works when it works. But I really think that Ivy's right. And I think, it's not just that it captures the human element of what we're talking about here. It's also that you guys know what you're talking about, right? Like I know when I'm talking about something that I'm proximate to, the way that I talk about it is different, right? I remember how I advocated for CCAP before I actually filled out one of those applications myself and had printed out all the paper, right? And saw that there was only a fax number, right? And last year we had the pilot to see if we can have it be online. Like that's a very meaningful change. I also think that ties back to what Ivy was saying earlier around there's different ways to make policy change. Legislating for change is one of those, right? But lifting your voice in conversation with IDEC and saying, here's what providers like me are concerned about, that's another form of creating policy change, right? And so all of those are needed, I think.
Yeah, and there was a question in the chat really quick
Mhm.
that said, if we're a parent with a child experiencing a developmental delay, but are not a professional provider, can we still like join the work group?
Please, yes,
Absolutely. Yes, you do not
absolutely.
have to work in the field to provide your experience. We encourage parents to join as well. Um,
Absolutely. We also have out of our group came a family to family support group for early intervention families. And I'll drop the link in the chat here to their group as well. They do great work and we work in tandem with them. But I know again, there are things that sometimes I only want to talk about people who have firsthand knowledge, right? Whether it be pregnancy loss or whether it be something else, right? There are times when you want to talk with other people who are in your same position or who have, proximate experience to what it is that we're discussing. So important.
yeah, definitely. Being around like-minded individuals who just get it is just so peaceful. Just really quick,
Oh,
another
yes.
way.
Thank you. And we forgot
Yeah,
to do that.
we talked a lot about IDEC. We talked a lot about funding design. And so please share your voice with the Illinois Department of Early Childhood. Feel free to use a QR code or the web link. They have engagement opportunities and listening sessions. So we encourage folks to, join those calls, listen in, have your pulse or have your ear to what's been going on. So you have your finger on the pulse of what's happening. So we're able to advocate if you hear like, oh wait, actually, I don't really like that proposal for that funding design because of XYZ, we're able to really advocate for and share our perspectives. Um, we are also having an early childhood advocacy day. It'll be May 13th. Um, we're saying that registration will start around 10:30 in Springfield, and then the buses leave at 2 p.m. We do have a pickup location in Chicago and one North Dearborn. The buses will leave like around 6:30. Um, However, there are other buses depending on where you live. We are having a bus that will pick up people in Evanston and Arlington Heights, Peoria, and I believe Rockford as well. So feel free to click the link and register and hopefully find a bus route that's convenient for you. But you can always come down using the Amtrak or driving on your own. Really, Early Childhood Advocacy Day is about all advocating for all early childhood programs, not just like early intervention, but also home visiting, childcare, and really kind of convening with other organizations, other like-minded folks who just really care about helping children and families. So from my perspective, it just always feels so powerful to be there. From 12 to 1, we're also going to plan a rally during in the rotunda in the Capitol building. And it's just so nice to be like in a sea of people where like everyone is like on the same page. It just feels really powerful being a united front in that way. And we also are encouraging people to meet with their legislators. When you register for ECAD, during the registration table, there'll be fact sheets. So you don't have to like remember all the data. You will have like information now, like, what the asks are, but also kind of framing, like how to talk to your legislators. There'll be opportunities with volunteers to maybe craft your message and how to like talk to your legislator. And also in the registration page, if you're like, I want to talk to my legislator, but I don't know how. Feel there's a question in there about connecting with them. So maybe you don't know who your legislator is. Maybe you don't want to go alone, and so we can find a group of people to come with you. And so feel free to register. We would love to see you there. And this is just like our handles for Raising Illinois. We're on Twitter, we're on Facebook, we're on
Absolutely.
Instagram. Feel free to contact our team, sign up for to get involved. This is also a QR code that leads to the Join Us page for Raising Illinois. Yeah, thank you so much. Does anyone have any additional questions? We still have some time together.
And I will be saving the chat just for everybody. I'm sure
Great.
the questions are we're all these links. They will be in the follow-up email. So any links that Simone or Ivy's put in the chat, and then again with their slides, that will be sent out.
Thanks, Kristen. Anything that's of interest to you guys that we didn't cover? Because we love being in community with you guys. So if there's anything else that you would like covered, let us know. We're happy to.
Here is someone in the chat asked for the ECAD registration page. So I'm going to put it in the general chat and then also in the Q&A portion.
And I think I finally figured out how to both be responsive in chat and down and upload our memo at the same time. Maybe. Here we go. I did it. Okay. That's the memo that we developed with IDAC and with that group of 90 to 128 infant toddler providers. So it goes through a lot of the things that we talked today about the funding changes that IDAC is proposing, which may be of interest to you guys. Absolutely. All right. If there's any other information that would be useful to you guys, definitely let us know. We'll hang out for a couple more minutes. And if not, it was lovely connecting with you guys. Thank you for having us.
Yes, please feel free to reach out to Raising Illinois, to Simone, to myself. We would love to stay in touch and be friends, whether it's joining the coalition or if you have any questions specifically about what we talked about, we would love to connect with you. And thank you so much again for attending. I know lunch series are always a little difficult while you're listening and also like trying to funnel your lunch. So we just appreciate you coming and, actively listening. Thank you.
Thank you.
Thank you, everyone. And huge thank you to Ivy, Simone, and Jesse, who was not able to join us today. The last 2 weeks have been so impactful and so fun for us. I can't wait to,
We love it.
figure out what else we can do together to support the children and families who need advocates out there and their voices heard. So thank you everybody for attending. You will get a follow-up email that will have all the information and yeah, everybody enjoy the rest of your day.
Great.
Thanks everyone.